Unlike the chain of survival for adults, which begins with early recognition and calls for emergency assistance, the chain of survival for a child dictates that high-quality CPR starts immediately. Infants and children have a higher survival rate than adults following immediate CPR because their bodies are more resilient than adults and because it's usually an airway blockage that causes them to need CPR. Children must receive CPR right away to increase their chances of survival. What is the chain of survival for adults? According to the American Heart Association, the 5 links in the adult chain of survival are: 1. Recognition of cardiac arrest and activation of the emergency response system. 2. Early CPR or cardiopulmonary resuscitation with an emphasis on chest compressions. 3. Rapid defibrillation. 4. Basic and advanced emergency medical services. 5. Advanced life support and post-cardiac arrest care. What is the chain of survival for a child? The pediatric chain of survival consists of 1. Prevention of cardiac arrest. 2. Early, high-quality CPR. 3. Rapid activation of the emergency response system. 4. Effective advanced life support. 5. Integrated post-cardiac arrest care. What 2 chains of survival pathways in cardiopulmonary resuscitation are the same for an adult and pediatric victim? The 2 chain of survival pathways in cardiopulmonary resuscitation that are the same for an adult and pediatric victim are early recognition and activation of the emergency response system and early cardiopulmonary resuscitation. What are some essential considerations when providing CPR to infants compared to adults? Some essential considerations when providing CPR to infants compared to adults include the need for specialized equipment like an infant-sized bag valve mask, using 2 fingers for chest compressions instead of the heel of the hand, and the need to clear the airway of any obstructing material. What are the critical age cutoffs for determining whether to provide adult or child CPR? The critical age cutoffs for determining whether to provide adult or child CPR are typically defined as age 8 or puberty. Children under age 8 or before puberty generally require child CPR, while those over age 8 or after puberty typically require adult CPR. How do the anatomical and physiological differences between adults and children impact the effectiveness of CPR? The anatomical and physiological differences between adults and children can impact the effectiveness of CPR. For example, the smaller size of a child's chest and airway can make it more difficult to perform effective compressions and ventilations. Additionally, children's hearts are more likely to stop due to respiratory failure than adults, which can impact the underlying cause of cardiac arrest. How would you determine if a victim is an infant, child, or adult? To determine if a victim is an infant, child, or adult, you can look at the victim's physical characteristics such as size, weight, and age. Typically, an infant is considered to be under 1 year of age, a child is between 1 and 8 years of age, and an adult is over the age of 8 or after puberty. Why is complete chest recoil important in CPR? Complete chest recoil is important during CPR because it allows the chest to fully expand between compressions, allowing for optimal blood flow from the heart. CPR is needed when a person's breathing or heartbeat has stopped. Why is rapid defibrillation important? Rapid defibrillation is important because it can restore the heart's normal rhythm and improve the chances of survival. Defibrillation delivers an electric shock to the heart, stopping the abnormal rhythm and allowing it to resume its normal beat. How do rescue breathing techniques vary between adult and pediatric patients? Rescue breathing is a crucial component of CPR, and the technique varies between adults and children. When administering CPR to adults, responders tilt the head back, pinch the nose shut, and provide 2 full breaths. In the case of pediatric patients, the process remains similar, but the breaths are administered more gently, maintaining a ratio of 30 compressions to 2 breaths. This adjustment considers the anatomical and physiological differences between adults and children, ensuring effective ventilation during resuscitation. Is there a difference in using an AED on adults compared to children or infants? The use of an AED is a vital aspect of CPR, and there are distinctions in the application for adults and children. For adults, AEDs typically come with adult-sized pads, and users must follow the device's prompts for proper placement and operation. In pediatric cases, AEDs may have specific pediatric pads, but if unavailable, adult pads can be used with adjustments based on the child's size. Understanding these adaptations is crucial for efficient and safe defibrillation in both adult and pediatric populations. In what scenarios might pediatric CPR be more challenging or require a different approach than adult CPR? Pediatric CPR may present unique challenges in scenarios where children vary significantly in size and weight. Responders must be adept at adapting compression and ventilation techniques based on the child's age and physical characteristics. Additionally, pediatric cardiac arrests often result from respiratory issues rather than cardiac causes, necessitating a nuanced approach. Proper training and experience are crucial for responders to effectively navigate these scenarios, ensuring the best possible outcomes for pediatric patients. So there you have a detailed video about the adult and pediatric chain of survival, and I hope liked it. If so, make sure to subscribe to the channel and turn on the notification bell for future updates. Thank you.